Hey, everybody. Happy Friday afternoon in Santa Fe. Thank you for joining us. Thanks for listening in and watching. I'm here at City Hall wearing my face mask because we need to get to green. We got the results of Santa Fe County. We're still yellow. The governor, we'll talk about it in a minute, changed some of what yellow means, but she also clearly said, if you want to get to green, you got to drive down the positivity rate and drive down the spread. The numbers on cases, while, boy, we would have loved to have had these numbers months ago, right now they're not going to get us to green. The last 3 days, 10, 14, and 14 for an average right around 12.3. We've got to get way down into the single digits. And so please remember, if you want to get to green, if you want to get to the turquoise, which is the next level, wear your mask, use hand sanitizer, take a test. You can get free testing at your home from Vault. Vault Health will send a free kit. You can take the test at home. So please, let's get to green. Let's stay safe. Let's shrink the number of cases. Let's bend the curve. Vaccinations are increasing. New vaccines are on their way, and we have to get there. We want to open up this summer. So with me, as usual, on a Friday, is Dr. Wendy Johnson, the Chief Medical Officer for La Familia. Dr. Johnson, nice to see you again. I hope you
nice to be here.
It's always good to have a chance to catch up with you because you provide both very specific reports on how things are going and also a good big picture of how the overall battle to get COVID in the rearview mirror is coming along. So let's get right to it. Always a big issue in dealing with COVID is the vaccine supply. We know the demand is high. We know the state has vaccinated in more than 500,000 people. That's a good thing. We heard a week or so ago that Alaska is the only state, I believe, that has a higher vaccination rate than New Mexico. So all that's good news, but supply isn't keeping up with demand. So let's talk about vaccinations from the point of view of more vaccine coming to New Mexico. What can we expect looking forward so people can start to calibrate their expectations about when their turn will come?
Well, I think that a couple of things. One, yeah, we've been throughout this whole thing, we've been in the top 3 states in the country for the percent of people in our population in our state getting vaccinated. The other really nice thing is I think the governor said yesterday, and the dashboards say we're actually the #1 state for getting our vaccine in arms. So if you look at it, some days we look like we're over 100% even, depending on when you look at it, when they get the shipment in of the new ones, because there's a little more doses than what they officially say in each vial. And so we could look like we're getting more than 100% sometimes. And so we've been the #1 state for that. And what that reflects is 2 things. One, we're really effective at getting these vaccines out. So even though I know some people are frustrated with the DOH and with the app and with the, we get calls every day at La Familia. Hey, I'm, over 75. I've been on the app for a long time. I get calls from friends and family and, what's going on here. And we can talk about that a little bit. My short answer to that is I would just call that website every single day, call the number on the DOH app every single day. You will get in. And we'll have some other things to say about that too, things that are coming up. But even though I know there's some people frustrated, it's really a very complex and kind of Herculean task. The strategy of the state of New Mexico has really been to target those that are most at risk of severe disease first. So that's the over 75, and that's those people with the very most serious chronic diseases, which predispose you from getting serious COVID, from possibly dying, from possibly being on a ventilator in the hospital. So that's been our strategy. Other states have had different strategies. I know there's a lot of consternation about teachers, essential workers, people that might be 74, or, some states have dropped the age, but our strategy has really been to focus on those most at-risk categories, and within those most at-risk categories, also some populations that might be harder to reach, like folks that are living in high-risk zip codes, folks that are living in rural areas, folks that might be more poorer, folks that might only speak Spanish, people of color. And one thing is, through the IHS, we've also vaccinated a very, very high number of the indigenous population. So our strategy is good. We're number one because of, again, two reasons. One is we're very good at getting vaccines out. And number two is we want the vaccine in New Mexico. We're getting a really high uptake. I think it was, I can't remember on what call it was, but it might've been the press conference yesterday that David Grace said this, but incredible. At UNM, I think they said they've given out, I don't know, tens of thousands of vaccines so far, and they've had something like, less than 20 no-shows of that. So people are signing up, people are hungry for the vaccine. I'm from Ohio. I talked to a friend of mine in Ohio last week, and they said the uptake for the vaccine is terrible. I said, well, send us your vaccines because we need them. If you guys don't want them, we'll take them. So it's those two things it's great news for New Mexico. But again, I keep talking about the funnel. It makes the demand, as I said, this top of the funnel of the demand much less than the supply right now. And so, the governor is really committed to really getting almost all this very vulnerable population vaccinated before we go on to the other groups. So as fast as we can do that, we're all working very fast to do that. And I hope at the federal government, they decide, okay, New Mexico's doing so good, such good uptake, let's give them even more vaccines. So we'll see if that happens.
And what's the latest news on Johnson & Johnson, which only requires one injection, one vaccination?
Right. I mean, it's real pros and cons. I mean, you take whatever vaccine you get offered, first of all. So don't be picky. But there are pros and cons of Johnson & Johnson versus Moderna versus Pfizer. The pros of Johnson & Johnson are definitely the one-shot aspect. It's very effective. It's not as effective as Moderna and Pfizer, but it's probably close to as effective at preventing severe disease. And it's probably going to be a little bit less available. I think the first tranche is only going to release like 4 or 5 million in the country. So I'm not sure how many we'll get of that here. But the other thing about Johnson & Johnson that makes it, really big pro is that it was tested a little bit later when some of these other variants were more prevalent. And it seems like it's better against some of these problematic variants we're hearing about. So we'll see how that plays out in real life. But I think the big principle of vaccination is still true. We need to get as many people vaccinated so we really push down that transmission to almost zero. And that's how we're going to get these variants to stop mutating.
And the orders for J&J can start from folks like you. When do you start requesting it? Not that you'll necessarily get it, but you have to send in like the equivalent of a drug order, right? Please send.
Exactly.
And
every week we send in our wish list, and next week we'll make an order for Johnson & Johnson to get it the following week. So that's what the DOH has told us.
All right, fingers crossed. All right, let's talk a little bit about how do we get to green and then how do we get to turquoise. We were on the cusp of green. We're still yellow. The governor changed some of the internal definitions of what yellow now means. We're a little further down the road. An essential retail space can open up 33% of maximum capacity. That's up a little bit. Food and drink establishments, if they have their New Mexico Safe certification, 33% for indoor dining and 75% of maximum capacity for outdoor dining. So we're seeing, even within the yellow category, a little bit of more flexibility. Obviously, we want to get to green, and then she announced a whole new color, a very New Mexico color. You want to get to turquoise. You want to go down the turquoise trail. So what is it going to take for Santa Fe County to get green, stay green, go to turquoise, and what do we get if what are the prize? Show everybody what we win if we get that prize. What do we win? Tell us,
Well, maybe,
Don Pardo.
yeah,
What
right. Maybe we get concerts in the, I talk about this a lot. I don't know why it's one of my favorite things about Santa Fe, but maybe we get concerts on the plaza in the summer. Maybe we get the Lensic reopened. Maybe we get to go to movie theaters again. That even at a very small level, we can do that in yellow and green, but to really open those things up, we do need to get to turquoise. And, it'd be great to get to turquoise by the time the summer weather is good. Maybe we get the Rail Yard concert series back, stuff like that, so that we can have a summer where we can have some of our great traditional, and then I mean, I'm not even sure what the planning is for all this. I'm sure, Mayor, know way more about this than I do, but even maybe some of our big, downtown events like, Indian Market and Spanish Market and all of that, the folk market, if we can really get to turquoise and really get this down and really get the vaccines out, maybe we can have some form of those. Maybe not quite as big, I'm not sure, but maybe some form of those this summer still. So there's a lot of hope that that's what that might look like. Might be different, but before people lose their minds right now, because I know we're all about to lose our minds, we're all like, ready to go. I'm on the phone with, I'm drove by, saw Cowgirl opens March 1st, and Boca is another one that is a favorite of mine and is opening soon. And I see the chef there is on the social media putting the new dishes out, and I'm right there with everybody else thinking, that looks really good. I really don't want to have that takeout and have it cold in my house. I want it, sitting at an outdoor table or even an indoor table if it's safe. But right now, if we go crazy and do all those things and jump on all those things, we still need to get down to green. We still need to get a good number of our population vaccinated. So just hold the horses a little bit on all that. Even stuff that you may be able to do right now in yellow with the new mayor, with the new governor's guidelines. I was really I was wrong. I predicted we would go to green and we didn't. We were just a smidge above. And as the mayor said, we were kind of hanging out at that 10 to 20 cases per day level. And we got to get down, it needs to be around average of 10 or 11. 12 is the cutoff for us. So that's 8 per 100,000 more or less for us. So we need to get it down to, hopefully below 10 cases a day. And that means all of us need to be very careful going forward, at least, for the next month or so until we do get a good number of folks vaccinated.
14 is not going to cut it. And so
right.
I love your energy, Doctor, because we do think that this summer has great promise for lots of things, for being in the park, for using our rec facilities, our trails, our biking, our hiking. I think we're all ready for recovery. We're all ready for rejuvenation. And there's a lot of reason to believe that there will be a stronger than predicted economic recovery. And we know that there's a bill in the Congress for $1.9 trillion. That's a lot of money where I come from. That's a big boost for our economy. There's another bill behind that President Biden has been talking about for infrastructure, and another one after that for investing in people and human capital. I think the federal government is really going to be investing in a strong recovery. Locally, you're right. We've talked already with our absolutely heritage, iconic markets, Indian market, Spanish market, folk art market, the opera potentially having a good but different kind of season. The Fuego schedule has been published. I'm a crazy baseball fan. All of that is in our control. We can make it happen, only if we take care of business now. And by the way, the more we take care of business now, the more there will be real business over the summer as tourists come back, because that's the other thing that I'm hearing from economic analysts. There is enormous pent-up demand across our country for people to go back to their favorite places as tourists and spend money buy things, enjoy Santa Fe, our restaurants, our festivals, our fiestas, our markets, our movies, our outdoors. People come here because it's wonderful. However, we've got to take care of business if we want to get their business. And that means the next month will be critical, absolutely critical to clamping down. Talk about equity. And the governor made an announcement about vaccination equity. We know we've got some high zip codes where there have been hotspots for COVID cases. There was an announcement about trying to do more to get vaccinations to people who might otherwise not meet the criteria if you're strictly playing by 75 and up. I think you said last time we were together, it's intrinsically going to be, the numbers will intrinsically shy toward people who are 75 and up being Anglo, because life expectancy in our community and around America for Anglos is longer. And therefore, there are fewer people of color who are hitting that 75 plus number just because of life expectancy. So we don't want that to be the only factor when it comes to providing vaccinations to people, or we'll leave out some of our most vulnerable people simply because of the racial bias of life expectancy. So where are we headed for more equity in Santa Fe County and across New Mexico? Do you have a read on that?
Well, I think there's a lot of things in the works that are going on. One is that, remember, we're also vaccinating people that are under 75 with any kind of chronic illness that is, well, not any kind, but chronic illnesses that are qualifying. And you can go on the website and see what those are, but any kind of heart disease, any kind of kidney disease, immunocompromised just because of a liver transplant, diabetes. We have a lot of diabetes in our community, hypertension, any kind of heart disease, including, high blood pressure or history of a heart attack or anything like that will qualify. Did I say this already? History of cancer. So those are the big ones, I think. I got them all. But those are the big ones. I know that there's a lot of people with a lot of other chronic illnesses, a lot of other autoimmune diseases that are in that second tier of diseases that are, pretty anxious to get the vaccine. And hopefully that will be opened up to that soon. But as I said before, the strategy of the state is really to vaccinate those people that are the highest risk of dying or going into the hospital. And that's why they've taken the strategy really methodically. So although what you say is true about the over 75s, those are all also the people most likely to go in the hospital and have severe disease, and this other group. What we're doing, what the state is doing, and also La Familia is doing to try to address that equity issue is, we're reaching out, not waiting for our patients to call us. We're calling them, only our patients at La Familia, but I know Christus is doing the same thing. I know, for example, the Cancer Center at Christus proactively called all their patients that are currently in treatment and offered them vaccine. And we're doing the same thing with all of our patients who qualify based on those diagnoses. Now, a lot of people don't have primary care that's either Christus or La Familia in the city and in the county. So, they are really dependent on the DOH, and the DOH is giving a lot of vaccines here, about 1,000 vaccines a day, 4 days a week. So they're giving a lot of vaccines here, but there are a lot of people that want it too. So some of the things that the governor announced yesterday is the possibility of looking at having walk-in clinics where you wouldn't have to schedule, you still have to be in the qualifying group. But if you weren't getting called from the app and you didn't know what happened and you called the phone number and you couldn't get in, you can walk in, you can say, hey, I'm on the app, but those haven't been announced yet, but they're talking about possibly doing those. Some mobile vaccine clinics in rural areas is another thing they've been talking about, and doing these things in those hard hit zip code areas. So there is work afoot right now to do specialized clinic for seniors specifically, and this could be seniors with chronic disease over 60 years old, or those over 75 without chronic disease, to do a specialized event for seniors in Santa Fe in late March. So the DOH is working with the city and the county to work on that. The date isn't set yet, but I'm sure that'll be well publicized when it is decided. So there's a lot of other things that the state and the city and the county and the local providers are working on. We have many, many meetings, coordinating meetings every week with all those entities to try to really look at this equity issue and make sure that we're not waiting for people to come to us. We're not waiting to reach out to folks. La Familia also has a lot of undocumented immigrants that come to us. And I just want to make that point.
Yeah. Do our undocumented residents have anything to fear if they show up for a vaccination?
So, I think that the main question is, there's a lot of fear amongst the undocumented population about putting your information into a government website, right? So this is a completely protected government. This website is completely protected. Information doesn't go anywhere. And there's nowhere on it that you would have information that would identify you as an undocumented immigrant also. So you're really just saying your name, your date of birth, whether or not you have these qualifying chronic conditions, where you live, that's it. So there's no way to find that information out. No one's going to ask you that when you come to the vaccination clinic. So it's not connected to any other databases. So you really should feel like if you're in the qualifying groups, go ahead and register on the app so that you do get called.
Let me just call one thing out to your attention and for our listeners and viewers, our global audience of people who are glued to our WebberCast. This past Wednesday at a city council meeting, we passed a resolution designating the first Monday of March as COVID Remembrance Day. This is a national effort. We're part of it. We're very glad we can take part in this recognition because we have had a tremendous loss of life here and around the country. We know we've nationally now passed the 500,000 mark. And here in our county and across New Mexico, we've lost many loved ones, family, and friends. So we're going to have a day of recognition and remembrance and mourning to honor those who we've lost and the families and friends who have been affected by that loss. So that resolution that we passed is on the city's website. We're part of a national movement. I think it's important that we recognize what an unprecedented catastrophe and crisis this has been. I think we're all feeling like there's light at the end of the tunnel and hope is coming our way. But in the meantime, we should honor and recognize and take a minute to mourn the people we've lost. It's been a heavy toll on families and friends here in Santa Fe and all over New Mexico. So that's something, if people are not aware of it, this Monday, first Monday of March is COVID Remembrance Day. Last thoughts, Dr. Johnson, about how do we get to green? We should wear our masks, use our best effort to wash our hands, practice physical spacing and distancing, take a free test at home, go on the vaccine dashboard, register if you haven't. You say it every time we're together, register, register, register. That's the way to get in the queue for a vaccination. Any other last thoughts for this Friday?
Yeah, I would just say, I know people are chomping at the bit to travel, to do all these things. From our own staff, people are anxious to see their family members again, to travel and see, maybe parents who might live out of state or far away, or just for your own pleasure. We've been cooped up for a long time and we want to get out. And I would say just hang on for a little bit more before we can do that. and try to be careful for a little bit more before you gather in big gatherings, have a big party, do anything like that. And we can get out of this. We can have a great summer if we can just keep the course for a little bit longer.
Yep. Get tested so our positivity rate looks good, especially if you feel great. Now's the time to get tested. Don't wait till you don't feel great.
I would also say it's a terrible allergy season again. You know, those of us who have allergies, I actually have the fall allergies, but I know that a lot of people have the spring ones, and I know they're starting to happen in full force right now. So, you know, don't take it for granted that it's allergies. If you do get symptoms, go ahead and get tested so you don't expose other people accidentally. Don't blow it off. Oh, I'm sure it's allergies. Go get tested just to make sure. It's easy to get tested now.
It is easy. And as I said, you can do it for free. You can do it at home. That Vault kit comes straight to your mailbox. So take advantage of that. It's free. It's easy. You don't have to put a swab in your nose or anything like that. So please take advantage of that. Great, Dr. Johnson. It's good to see you as always. Stay well yourself. You're on the front line out there. And we'll see you in a week. Take care of yourself.
Yeah. We'll see you next week. Bye, Mayor.
Thank you for being
here.
All right. Our good friend, Dr. Wendy Johnson, is always really a source of medical advice and very sound advice about how we can get to green, get to turquoise. I'm going to make a couple quick comments and then we will call it a Friday. We had a very intense, strong meeting of the governing body this past Wednesday. One of the major issues that was discussed was streetlights and our sustainability agenda. We had three ordinances on the city agenda, all relating to Santa Fe going green, not going green with COVID, but going green with sustainability. First ordinance was all about replacing our antiquated and very environmentally unfriendly streetlights with LED lights. They use much less energy. They save money. They save tax dollars. They are easy to fix and replace. They are much less likely to light up the night sky because the light all goes down. It doesn't leak to the side or go up. The concerns that were expressed were largely around the impact of the LED lights on our night skies, which are gorgeous in Santa Fe. If you go out at night, we have, of course, it's very bright right now. We've got a full moon, but when it's not a full moon, you go outside, the stars are so close you can touch them. And that's the beauty of Santa Fe. A lot of folks spoke to the need to adopt LED lights, but do it the right way. So we passed an ordinance that gives us 3 months of public input, public engagement to test different kinds of LED lights, different settings of lumens and kelvins and many different technological terms and engineering terms to come up with the right solution for Santa Fe. And maybe not the right solution, one size fits all, but the nice thing with this project is neighborhoods, different parts of town, different roads, different streets, different areas can have different solutions. So our Public Works team, led by Regina Wheeler, who has done a phenomenal job shepherding this project along, they'll be working to come up with public engagement, public input, and a publicly endorsed plan that will come back to the governing body to be adopted before the street lights are changed out. Another part of the package that was voted on Wednesday night is about $15 million worth of sustainable investment for renewable energy, for solarizing city buildings. We will take a major step toward solarizing city facilities with this $15 million investment. And the great news is that both the streetlight project and the solar project will pay for themselves by the amount of money we save with reduced energy costs. In addition, they will be easier to maintain. We heard at the council hearing that over the past period of time, something like 1 million streetlights went out. They burned out, they broke down, they were simply out of order. They weren't functioning correctly. That meant we had lights that needed to be fixed. Sometimes it took a long time to get a work crew out there, or for PNM to get a work crew out there, and people got frustrated with the light situation. LEDs will make that problem go away. So it was a very robust hearing. It was a very informative hearing. We had people with great expertise in energy and lighting and in neighborhood livability, talking to the governing body, sending us emails, really passionate about quality of life and livability in Santa Fe. And that's one of the reasons we have such an outstanding quality of life here and so much great neighborhood livability is people care. They care enough to comment. They care enough to attend council meetings. They care enough to write us, email us, call us. That level of engagement and passion and concern is what keeps Santa Fe special, makes us the place people want to live, not have to live. So thank you to everybody who spoke up, everybody who wrote, everybody who attended the hearing and offered their points of view. And also, I really want to salute Regina Wheeler. You know, I think it's easy these days. COVID-19 has taken a toll on everybody's temperament and mood. It's easy to get a little bit short or angry or defensive. Regina Wheeler is a professional's professional. Just did an outstanding job listening, taking everybody's point of view, respecting everybody's point of view, and honoring everybody's point of view. That's why we're going to have this period of time for community engagement and input as we begin to build our way forward toward a 21st century streetlight solution. And we also had a briefing on Midtown led by Rich Brown and the team that's looking at Midtown. If you missed that, there is a slide deck that described the process going forward and the work to be done to evaluate the choices for Midtown Santa Fe campus development. Very good piece of work by Rich and his team. I can't say it often enough. We are so fortunate to have the level of commitment and competence at our managers of our departments in Santa Fe right now, an outstanding group of people. You may have read in the newspaper about our audit being late. It is going to be late. There are both extenuating circumstances, things like COVID have made a difference, but we have simply been doing an enormous amount of work to fix our financial condition. If you think back to where we were 3 years ago when I became mayor, there was a document called the McHard Report that we were handed. It was a lengthy investigation of the city's financial practices. And it found many situations, many cases where there could be fraud. Not that there was fraud, but the lack of controls and modern technology, modern software meant that people could have taken advantage of our system. It was a red flag of warning that we needed to improve and upgrade our software, our training, our oversight, our audit trail. And we've been working very hard. Mary McCoy and her team in the finance department have made huge improvements in all of those areas. I was on a call yesterday with the state auditor and with the chair of our audit committee to talk about the fact that we know we need to do better, but it's also worth acknowledging just how far we've come in improving the city's financial management. And we're all aware these are your tax dollars. We need to treat your tax dollars with respect. We need to be transparent, and we need to account for the money that you give us to provide services back to you. We had a very good conversation with the state auditor, Brian Colon. Could not have been more helpful, more gracious. It's a serious issue, but it is an issue that we are serious about fixing. And Auditor Colon and his team were absolutely committed to work with us, to help us, to stand with us as we work our way forward with a step-by-step plan to get the audit completed and to do better in the future. I'm very impressed with the quality of our conversation with the state auditor. I'm also impressed with the list of improvements that have been made as measured by the chair of our audit committee and identifying progress against that McHard report. It still is the roadmap for improvement. A lot going on in Santa Fe as we head into the spring and into the summer. Please take Dr. Johnson's advice. When you go out, wear your face mask, use hand sanitizer when you come home. Please continue to practice physical distancing. It is now okay to go eat at your favorite restaurant. That's the good news. But when you eat at your favorite restaurant, please remember to follow the rules with face masks, hand sanitizers, physical distancing. Please, let's get to green. Let's find a way to bend the curve low enough that Santa Fe County moves from yellow to green, from green to turquoise. If you are signed up to get your vaccination, when you are told to show up, please make that appointment. We want to get shots in arms. That's the way we're going to make it through this. In the meantime, if you haven't gotten your call, if it hasn't been your turn, do everything you can do to bend the curve, prevent the spread of COVID. Until I see you next week, please remember to take care of yourself, take care of your family, take care of the community, and together we will all take care of Santa Fe. Take care. I'll see you next week. Have a wonderful weekend.